Welcome to the Disease Book. Today we are opening our clinical pages to look closely at a common yet critical gastrointestinal condition, diarrhea. It's the ultimate schedule ruiner, right? But the actual mechanics behind it and its massive global impact are surprisingly fascinating. We're going to cover the whole shebang from spotting the signs to uncovering the root causes and finally looking at the best ways to manage and prevent it. So, to really grasp what's going on, we have to start with a basic question. What exactly is happening in your gut when things go so wrong? Usually, you just want it to be over first, but taking a moment to understand the actual mechanics. That's a real game changer for how we manage it. Here's our roadmap for today. We'll start with what diarrhea actually is, move on to spotting the signs and symptoms, dig into the root causes, talk about effective management and diet, and finish up with prevention and medical care. Alright, let's kick things off with one section. What actually is diarrhea? Medically speaking, there's actually a very specific threshold here. It's defined not just by consistency but by frequency. We are taking three or more loose or liquid bowel movements in a single day. Frequent passing of normal formed stools doesn't count. The naturally loose stools of breastfeed babies also doesn't count. It specifically has to be an abnormal increase in both fluidity and frequency. Now think about this for a second. This is the massive volume of water entering our gut. Every single day we drink and eat about 2 liters. But get this, our body actually adds another 7 liters through secretions like saliva, stomach acid, and wine. That is 9 liters of water sloshing around daily. Normally, your intestines act like a super absorbent sponge and soak almost all of it up. But if a bug or an insect throws a wrench in that absorption process, even slightly, all that fluid just rushes straight through and back. Watery stools. We can also categorize things based on the timeline. Acute diarrhea is the one you are probably most familiar with. It's short lived, usually lasting just a day or two up to maybe a couple of weeks. And it's almost always from a viral bug or something funky weird. Chronic diarrhea, though, is a totally different ballgame. That's when it persists for 30 days or more. If you are hitting that 1 month mark, you are looking at deeper underlying issues like irritable bowel syndrome, celiac disease, or other inflammatory conditions. But we really have to look past the biology for a second because that's just staggering. Frankly, sobering World Health Organization statistics, we need to talk about 4,43,832. That is the number of children under the age of 5 who die every single year from this highly preventable disease. To put that into perspective, while adults might see it as just as weekend ruined, globally it is the third leading cause of death for young kids. Moving right along to section 2. Spotting sign and symptoms. You see, the absolute biggest threat here actually isn't the infection itself, it's dehydration. When an episode hits, your body is rapidly losing water and vital electrolytes like sodium and potassium. The WHO breaks these danger down into three stages. You start at no dehydration, but things can escalate quickly to some dehydration where you feel restless and super thirsty, and then it hits severe dehydration. This is a life-threatening stage marked by extreme lethargy, sunken eyes, and inability to even drink, and sometimes unconsciousness. And it gets even more complicated. When we zoom out and look at overall nutrition, it creates this tragic feedback loop. Every single diarrheal episode robs the child of the nutrients they desperately need to grow. Because of this, it's actually one of the leading causes of malnutrition globally. And in turn, a malnourished child has a much weaker immune system, making them incredibly vulnerable to catching deadly infections all over again. It's a vicious cycle that literally has to be actively broken. Okay, section 3, the root causes of diarrhea. So, what's actually causing this? Well, infectious diarrhea is triggered by a whole microscopic army of viruses, bacteria, and parasites. Usually, these invaders hitch a ride on faces contaminated food or water or spread from person to person. For kids, viruses like rotavirus and bacteria like E. coli are the usual suspects. And norovirus, you have probably heard it called the stomach flu. That one spreads like wildfire and can quickly take down entire households, schools, or even cruise ships. But what if it's not your standard stomach bug? There's actually a really fascinating mechanical difference when you look at chronic cases. We have got secretory versus osmotic diarrhea. Secretory is when a nasty pathogen like cholera essentially hijacks your gut cells and forces them to pump massive amounts of fluid directly into your bowel. Osmotic, on the other hand, is when you eat something you just can't digest, like lactose if you are lactose intolerant. The unabsorbed stuff acts like a giant sponge pulling water right into your stool. The dead give away. Osmotic diarrhea actually stops if you fast simply because you stopped eating the trigger. Aside from infections, sometimes our everyday choices are actual culprits. Believe it or not, common over the counter meds like ibuprofen, certain blood pressure drugs, or even going overboard on vitamin C or magnesium can cause a sudden sprint to the bathroom. And your diet plays a massive role too. Heavy high fat dried foods, ton of caffeine, or even the sugar alcohols found in sugarless gum. Yeah, they can severely irritate your digestive tract. Which brings us to section 4, effective management and diet. Alright, time for a major paradigm shift. Fasting to starve the bug is actually not recommended anymore. For acute cases, as soon as you feel up to it, you absolutely should resume a normal age appropriate diet. And infants, they definitely need to keep getting breast milk or formula. But there is a catch, you absolutely must avoid gut irritants. That means no alcohol, no caffeine, no heavy fried meals, and skip the ultra processed sugary treat. Eating simple sugars a day will just drop more water into your gut and make the whole situation so much worse. So, how do we actually treat it? Well, the absolute gold standard is not some fancy, expensive drug. It's ORS, oral rehydration solution. It's just a cheap, brilliantly simple mix of clean water, salt, and sugar that perfectly replenishes your lost electrolytes. Pair that with a zinc supplement, which studies show can actually cut the duration of an episode by 25% and reduce stool volume by 30%. And if you're dealing with a chronic situation, simply hitting your daily fiber goals, that's a 25 gram for women, 38 for men, can do absolute wonders to naturally buck things up. Finally, section 5, prevention and medical cure. Now, most of the time, acquired diarrhea is totally self-limiting. It clears up on its own in about 2 days, but you absolutely cannot ignore it if things escalate. You need to see a doctor if your symptoms drag on past 48 hours. If you are so dehydrated you can't keep water down, or if you are hit with severe abdominal pain, also, blood in your stool or a fever of 102 degrees Fahrenheit or higher. Those are massive red flags. It could mean a severe bacterial infection or an inflammatory disease that definitely needs professional clinical care. Zooming out to look at the big picture, we are dealing with nearly 1.7 billion childhood cases globally every single year. But the crazy part is we know exactly how to stop it. Simply foundational things. We are talking universal access to safe drinking water, improved sanitation to keep waste far away from our water sources. The basic act of hand washing with soap, promoting exclusive breastfeeding, and getting the rotavirus vaccine out there. These basic steps can completely slash this massive disease burden. As we wrap up this explainer today, I want to leave you with something to really think about. We have just seen how this incredibly common condition is deeply tied to the absolute foundation of human health, water, and sanitation. So ask yourself, how would universally safe drinking water and better global sanitation fundamentally change the future of childhood health worldwide? Because solving these highly preventable issue wouldn't just mean fewer stomach bugs. It would literally save hundreds of thousands of young lives every single year, completely unlocking human potential across the globe. Thanks so much for joining me on this explainer, and I will catch you in the next one. Thank you so much.